I knew that I loved women's health and I wanted to work with women. There's a lot of different ways that you can do that in medicine. For me, I originally started out and did training in obstetrics and gynecology, and I decided that I wanted to focus on a surgical subspecialty to make sure that I could focus on a very small field and be the best at that thing. And so for me, that became urogynecology, and I realized that I could help women and improve their quality of life. I am Ashley Huber, and I am a urogynecologist here at Penn Medicine. Being a urogynecologist means that I focus on the pelvic floor, and that falls into two major categories. I treat pelvic organ prolapse and do pelvic reconstructive surgery to help women who are suffering from prolapse symptoms. And I also treat urinary incontinence, and urinary incontinence comes in a few different forms, but I treat that both in the office as well as surgical interventions to help women regain that control in their life. I see women through all different phases of their life, from the postpartum period dealing with complications from childbirth, and then I also see women in the postmenopausal stage of their life. And the needs often are very different between these women. Patients feel vague symptoms often of feeling a vaginal bulge or urinary leakage and not really sure exactly when it's happening, or sometimes they do know when it's happening and it's certain activities that really cause them to leak urine. When you have these symptoms, it can be really impactful on your life. I've had patients come and tell me that they aren't going to their granddaughter's wedding because they're scared that there's not going to be enough bathrooms between where they have to leave to where they're getting to the wedding, and they're terrified of leaking. I've had patients who told me that they stopped running or stopped exercising because they are constantly leaking urine with those activities, which makes them self-conscious. This is about what is going to improve your quality of life at a time that you need the quality of life improved. My treatment options vary. I like to get to know their lifestyle because it allows me to know which treatment's going to be best for them. And we get to do shared decision making to really discuss about all the treatment options and figure out what best aligns with their goals of care as well as their lifestyle. If you were to choose me as a provider, I would want you to expect that we're in this together, that this is a process that is vulnerable. Many people don't want to talk about these issues that they're facing as they continue to age. But we're here, and it's a common problem that you are facing, and you should feel open to at least talk about it with myself and my staff in order to make sure that we can make you feel more like yourself. I love what I do every day. I just feel so lucky. I feel so happy that I get to see these patients, develop these relationships, and then provide care that makes them happy.